We have asked Dr. Kaushik Jain to join us. He is a heart failure specialist with Huntsville Hospital. So, Dr. Jain, thank you for joining us. And
thank you.
The first question that I have for you is, how serious is heart disease when it relates to how many Americans are affected by it every year?
Yeah, great question. So unfortunately, despite numerous strides to try to improve this, heart disease still remains the #1 killer of men and women in America, as well as still in Alabama, unfortunately. And so it's a very serious disease, something that we need to bring a lot more awareness to, and that's why we're all here today discussing it.
And what's the #1 cause of heart disease?
Yeah, so heart disease runs kind of a full gamut and a full spectrum, and we kind of call it cardiovascular disease. So that includes, heart attacks and strokes, but even things earlier on in the prevention phase, things like high blood pressure, diabetes, high cholesterol, those kind of run in the early phases of cardiovascular disease. Again, heart attacks, stroke remain at the top. Things like heart failure, heart muscle weakness, and heart rhythm issues are other occurrences for heart disease.
And so those would be kind of the more common types of heart disease.
Exactly, yeah, that's right.
Wonderful. And being physically active is a way to reduce the risk of getting it. Can you talk about some other ways?
Yeah, absolutely. Yeah. So again, physical activity, and we say that, and if you go onto websites, they'll say, hey, 30 minutes of moderate intensity cardiovascular exercise five times a week, and what does that mean? Well, different people have different lifestyles. So making sure that you use the stairs at work if you can, and taking other strides in your day-to-day activities to try to just go a little bit extra to make sure. I know a lot of people use their step counters, and that's great. Just making sure that you are attaining certain goals for your day, and you're keeping it kind of in your conscious that you need to exercise and be active. Certainly the other big component of that is diet and getting regular checkups with your physician.
And since we have you here as an expert on this subject, I wanted to ask you, is there anything that we haven't covered with you that you really think is important to mention?
Yeah, I think it's again very important for people out there. They always ask us, what should we do on our daily lives? And I think just having a routine is extremely important. Having a routine every day, making sure you're eating healthy, have certain routines and habits that you do to exercise, and that also sets a barometer, a gauge, so that we know, if you're walking 10 laps around the block to walk your dog every morning, and then now you're getting short of breath and chest pain doing that, well, you should see your doctor and get a checkup and see what we need to work on, whether it's high blood pressure, whether it's development of diabetes, whether it's development of heart artery blockages, whether it's a heart rhythm disorder or a heart valve disorder or heart muscle weakness. A number of things can really affect the heart and the body, and so we want to make sure that if you can't live long and be prosperous in that life, that we're there to help you along that journey.
Wonderful. Dr. Jain, thank you so much for joining us.